the honourable member for Dartmouth North.
Madam Speaker, women in this province are fighting to get the cancer care they need, and they shouldn't have to. Sarah Crookshanks is waiting right now for treatment after a diagnosis of aggressive triple-negative breast cancer. She found a lump in her breast in December, and it grew quickly. Despite her doctor's concern and advocating that she needed urgent care, she has been let down at every turn, with delays in imaging, biopsy, diagnosis, and referral to oncology. Sarah said, "I'm deeply concerned about the impact these delays may have on my prognosis." Madam Speaker, will the Minister of Health explain why women have to fight the system while they're fighting for their lives?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. And of course, I can't comment on any individual cases on the floor of the legislature. We absolutely want women and all Nova Scotians to have access to the care they need in a timely fashion. We continue to work on a number of different fronts. We look at screening. We're looking at diagnostic imaging. We are trying to create pathways, making sure we have the human resources in order to make sure that people can have those tests in a timely fashion. I know that the operators, IWK and Nova Scotia Health, are committed to this work, as are we. I recently met with the Nova Scotia Breast Screening Program to again make sure and recommit to the fact that we are here to support them on that journey to make sure that our rates of screening and diagnosis continue to improve.
I recognize the honourable member for Dartmouth North.
Madam Speaker, if the minister would like to take a look at this letter from Sarah, I will table it. It does outline her situation. Sarah's treatment delays are not following the guidelines for care. She should have gotten a scan in 14 days. It took 72 days. It's now been 21 days since she was diagnosed with aggressive cancer, and she's still waiting for treatment. Speaker, when you're told you have an aggressive cancer, you can't afford to wait while that cancer grows. Or here there's nothing to be done to speed up the process because the system does not have the resources. When can the minister tell women in Nova Scotia that there are enough resources to get them the care they need when they need it?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So I want to assure members of this House and members and folks across Nova Scotia that we are investing not only in equipment, but we're investing in the people. We're investing in training. We're looking at recruitment efforts. We're doing all of those things. Not only are we doing that in radiology and in diagnostic imaging, but we were also doing that in Cancer Care Nova Scotia. We know that it's very, very scary when you have a diagnosis and you're waiting for treatment. We depend on those experts to help us make those decisions. We want to give them the support that they require. We'll continue to work very hard with those experts, with clinicians, looking at the evidence to ensure that we have pathways that support Nova Scotians in seeking diagnosis and care.